High blood pressure often strikes silently, especially at night, and standard daytime readings miss the real risk in adults over 60. Understanding nighttime blood pressure, simple home factors, and targeted tests can dramatically reduce cardiovascular risk and save lives. Most people assume high blood pressure comes with clear warning signs: headaches, dizziness, feeling off. So if you feel fine, you must be fine. Right? Completely wrong. I've seen inside the bodies of patients who felt perfectly normal just days before a devastating stroke. And it's not rare, it happens more often than you'd ever expect. These are ordinary people, walking their dogs, preparing meals, laughing with their grandchildren, living life as usual right up until everything changes. No alerts, no symptoms, nothing to hint at what was about to happen. High blood pressure doesn't knock before it strikes, especially not at night, and especially not after 60. That's exactly what we're uncovering today. Here's the fundamental flaw in how blood pressure is typically measured. Your doctor checks it once during a visit for maybe 30 seconds. Just 30 seconds out of 86,400 seconds in a full day. And that tiny snapshot becomes the basis for your entire diagnosis and treatment plan. Meanwhile, for a large portion of those seconds, you're asleep. And that's where things become critically important. Under healthy conditions, your blood pressure does something vital while you sleep. It naturally drops by around 10 to 20% every night. This is known as the dipping pattern. It's not optional, it's essential. This is when your cardiovascular system carries out repair and recovery. Your heart restores itself, your blood vessels relax and heal, your kidneys filter and reset. Every one of these functions depends on that nighttime drop in pressure. But after the age of 60, things begin to shift. Your arteries slowly stiffen, your blood vessels lose flexibility. The entire system starts functioning differently, and your autonomic nervous system, the one responsible for triggering that nighttime dip, begins to lose its precision. The signals weaken, the rhythm fades. For millions of people over 65, that nighttime dip disappears entirely. Instead of dropping, blood pressure stays high or climbs even higher while they sleep. You wake up feeling drained, foggy, thinking it was just poor sleep. But the real cause is something far more serious. And most doctors miss it, because they're relying on that brief daytime reading instead of the full overnight reality, not even close to the full picture. Let me show you how real this is. A patient walks in with a blood pressure reading of 120/78. Perfect, completely normal. Nothing concerning. But I send him home with a 24-hour monitor. He goes through his day, goes to bed around 11. Then at 2 o'clock in the morning, while he's fast asleep and completely unaware, his blood pressure spikes to 164/102. That's not a small increase. That's a dangerous hypertensive surge happening silently while he sleeps peacefully, with absolutely no clue it's even happening. How does this actually happen? There are three primary drivers, and every single one becomes far more common after 60 than most people ever realize. First, his medication is taken in the morning. By the time midnight arrives, its protective effect has largely faded away. That gap in coverage is not theoretical, it's real and dangerous. Second, his stress hormones, cortisol and adrenaline, stop following their natural nighttime rhythm. Instead of settling down, they surge while he sleeps. Third, his sleep is broken and inconsistent. Every brief awakening, even the ones he never remembers, triggers a sympathetic response and a spike in blood pressure. And this doesn't happen once in a while, it happens night after night. Not occasionally every single night. The same surge, the same hidden strain, the same silent buildup of damage year after year. That damage accumulates quietly within the walls of his arteries, inside the delicate vessels of his kidneys, and deep in the tissues behind his eyes, month after month, without a single warning sign pushing him to seek help. The body keeps compensating in silence, until one day, it simply can't anymore. We actually have a clinical term for people whose blood pressure fails to drop at night. They're called non-dippers. And the statistics are alarming. More than 50% of adults over 65 fall into this category. More than half. This isn't some rare exception, it's the majority. Half of that population carrying a hidden cardiovascular threat that standard morning blood pressure readings will never reveal. So what does that mean for real-world outcomes? Non-dippers face a cardiovascular mortality risk 3 times higher than dippers who have identical daytime readings. 3 times higher risk with the same numbers during the day, the same medications, the same diet, just because of what's happening during those 8 hours of sleep. And then there's an even more dangerous pattern: reverse dippers. These are people whose blood pressure doesn't just stay elevated, it actually climbs higher at night than during the day. For reverse dippers, the risk of stroke increases 4 to 5 times. And yet during a routine office visit, they appear completely normal. Take a moment to process that. Standard office checks detect none of this. Nothing. Zero. That's the diagnostic blind spot we urgently need to address. Now let's turn to something even more surprising: the everyday items already in your home that may be quietly worsening your nighttime blood pressure. The first one is licorice root. It sounds harmless, even beneficial. It's marketed as an herbal tea, natural, soothing, perfect before sleep. Many people use it regularly, but licorice root contains a powerful compound that interferes with a specific enzyme in your kidneys. Without that enzyme, cortisol begins to accumulate in your bloodstream. Elevated cortisol at night drives your blood pressure upward. You don't feel it happening. You simply wake up drained, with no clear reason why. Check the label on your evening tea. Right now, licorice root may be listed as sweet root, glycyrrhizine, or hidden within natural flavoring and herbal blends. The second hidden trigger is alcohol, specifically alcohol consumed in the evening. And what I'm about to explain catches most moderate drinkers off guard. The initial sedative effect of alcohol can temporarily lower blood pressure. That part is true. But 3 to 4 hours later, a very different process begins. Right in the deepest stage of sleep, a rebound effect kicks in. Your sympathetic nervous system overcompensates. Blood pressure surges sharply upward. Cortisol rises. Your blood pressure can hit its highest level of the entire 24-hour cycle at 3 a.m. The third hidden factor is grapefruit juice, especially when combined with amlodipine or other calcium channel blockers you may be prescribed. Grapefruit interferes with the liver enzyme responsible for breaking down these medications. As a result, the drug builds up in your system. What was meant to act gradually becomes unpredictably prolonged. That instability becomes especially dangerous at night, when there's no monitoring, no awareness, and no immediate response if something goes wrong. So how do you actually uncover what your blood pressure is doing while you sleep? There is a test designed specifically for this. It's called ABPM, Ambulatory Blood Pressure Monitoring. You wear a small cuff for 24 hours while going about your normal routine. It automatically records readings every 30 minutes, day and night. This is the gold standard for detecting non-dipping patterns. It's the only way to see your true nighttime blood pressure behavior. Yet most people over 65 have never used one. Ask for it by name at your next appointment. If you don't request it directly, it almost certainly won't be offered. The second test is urine microalbumin. This detects tiny amounts of a protein called albumin leaking into your urine when the kidneys are under stress. Microalbumin is one of the earliest warning signs of organ damage from sustained high blood pressure, often appearing years before any visible decline in kidney function. It's an early alarm system, giving you time to intervene before damage becomes permanent, before it shows up anywhere else. The third test, and this one surprises many people, is oxidized LDL. You already know LDL as the so-called bad cholesterol. Oxidized LDL is what happens when that cholesterol is damaged by free radicals. In simple terms, it's rusted cholesterol, far more aggressive and destructive to your arterial walls. Standard cholesterol tests don't measure it, but it directly reflects arterial damage, the exact kind accelerated by sustained nighttime hypertension. Together, these three tests, ABPM, urine microalbumin, and oxidized LDL, reveal a level of clinical insight that no routine checkup can provide. They are accessible, relatively affordable, and almost never ordered unless you specifically ask for them by name. Write them down now. ABPM, microalbumin, oxidized LDL. That's your action plan for your next doctor's visit. Now let's move to solutions, starting with one of the most overlooked factors, the timing of your blood pressure medication. Most antihypertensive drugs are taken in the morning. That's the standard. That's the routine. But is it actually the best way to protect you overnight? The reality is that most blood pressure medications reach peak effectiveness within a few hours of being taken, then gradually lose strength throughout the day. If you take your dose at 7 o'clock in the morning, by midnight, its protective effect has significantly weakened, exactly when your body needs it most. The Hygia Trial, over 20,000 patients, followed for 6 years, one of the most extensive studies ever conducted. Researchers compared two groups, patients taking their blood pressure medication in the morning versus those taking the exact same medication at bedtime. Everything else remained identical. The outcomes were extraordinary. The bedtime group experienced nearly a 50% reduction in heart attacks, strokes, and cardiovascular deaths. Nearly half the risk cut down simply by changing the timing of the medication. Same drugs, same doses, completely different results. No new prescriptions, no higher doses, no complex interventions, just taking the same medication at a different time of day. But this is critical. Do not adjust your medication timing on your own. This must be discussed with your doctor first. Some medications are not appropriate for nighttime use, diuretics in particular. Your doctor needs to evaluate your individual case before making any change. But this is absolutely a conversation worth having. One simple question at your next visit could reshape your entire treatment strategy. It takes seconds to ask, but the impact could be profound. Now let me introduce something with real clinical evidence behind it. Something quietly sitting on the shelves of most health food stores, hibiscus tea. Specifically the dried flowers of Hibiscus sabdariffa. And before you dismiss it, let's look at what the research actually shows. Hibiscus contains compounds known as anthocyanins, the same pigments responsible for the deep colors in blueberries, pomegranates, and red cabbage. These compounds are potent antioxidants. They neutralize free radicals, the unstable molecules that damage arterial walls and contribute directly to oxidized LDL. But hibiscus goes further. It also inhibits ACE, the angiotensin-converting enzyme, the same target used by a major class of blood pressure medications. That's not a coincidence. It's a proven pharmacological effect found in a plant, validated in clinical trials, and confirmed by multiple independent research teams. Several clinical studies have demonstrated consistent reductions in blood pressure among patients with mild to moderate hypertension who consume hibiscus tea daily. We're talking about drops of 8 to 14 mm Hg in systolic pressure, even in individuals not taking medication. That's not minor, that's clinically meaningful. However, preparation is critical. Weak hibiscus tea delivers little to no benefit. Most people prepare it far too diluted to have any therapeutic effect. Use 10 grams of dried hibiscus flowers, not tea bags, not mixed blends, pure dried flowers. Heat water to around 90 degrees Celsius. That temperature matters. Steep for 10 to 15 minutes, not less. The extraction time is essential for releasing the active compounds. When prepared correctly, the tea should appear deep burgundy, almost like dark red wine. If it looks pale pink, it's under-extracted. Steep it longer. 3 cups per day is the amount used in clinical studies. But the most important cup is the one consumed in the evening, about 1 to 2 hours before sleep. That timing has the strongest influence on nighttime blood pressure. One important caution: if you are already taking blood pressure medication, do not add hibiscus without consulting your doctor. The effects can combine and amplify each other. This isn't a warning to avoid it. It's a reminder that natural compounds with real pharmacological actions can interact with medications. Always inform your doctor. You've just absorbed a significant amount of information. Let's distill it into 3 clear actions you can take starting tonight. Just 3. First, go to your tea shelf right now. Read every label carefully. Look for licorice root, also listed as glycyrrhiza, sweet root, or hidden under natural flavoring. If you find it in your evening tea, remove it immediately, move it to the morning, or remove it entirely. Tonight, second, be honest with yourself about your evening alcohol. No judgment, just accuracy. Is it a regular habit? Is it close to bedtime? If so, understand this: that rebound spike is real. It's happening at 3 o'clock a.m. every time, whether you feel it or not. You don't have to eliminate it entirely, but shift it earlier, have it with dinner, not in the hour before sleep. Third, take a piece of paper and write down 3 items: ABPM, microalbumin, oxidized LDL. That's your list. Fold it. Place it next to your insurance card. That piece of paper becomes your agenda for your next doctor's appointment. 3 simple items, accessible, affordable, and capable of revealing what your body is doing during the most critical hours of the night. These are not optional extras. These are the tests that uncover what standard office visits were never designed to detect. And here is the deeper truth: the reason this entire discussion matters. Your cardiovascular system never pauses, not for a second. Right now, your heart is beating. Your blood vessels are under constant pressure. It never shuts down. After 60, the margin for silent, sustained damage becomes much smaller than it was at 40 or 50. The body is incredibly resilient. It compensates, adapts, absorbs damage quietly, without symptoms, without warning, until one day it reaches a breaking point. And for many people, that breaking point occurs at night, while they are asleep, while they are dreaming, without a single visible sign. I've stood beside hospital beds after strokes, after major cardiac events. I've had those conversations with families and they stay with me. In a significant number of those cases, especially in patients over 60, the warning signs were already there, hidden in data that was never collected, in nighttime blood pressure patterns that were never measured, in microalbumin levels slowly rising year after year, in arterial stiffness quietly progressing in the background. And in many of those cases, the outcome could have been different. With one additional test, with one well-informed question asked at a single appointment, many outcomes can shift. Preventable in many cases, yes, not all. Medicine demands humility, but far more can be prevented than most people realize when they have the right information, when they ask the right questions, when they request the right tests, and when they have one clear, informed discussion with their physician at the right moment. You are fully entitled to that knowledge. You have every right to ask about nighttime blood pressure, about ABPM, about medication timing, about these specific tests. You are not being difficult. You are not being unreasonable. You are taking an active, responsible role in your own healthcare, and that distinction matters more than most people understand. That level of engagement, based on years of observing patients navigate the system, truly saves lives. Not as a phrase, but as a clinical fact. Patients who ask questions, who come prepared with notes, who follow up, they consistently receive better care. The evidence supporting this is strong and consistent. Today you now hold something most people do not have when they walk into a doctor's office. Precise, targeted, actionable information. Let's bring everything together with absolute clarity. Not just ideas, but a clear plan. Your daytime blood pressure reading is only a starting point, not the full story. Nighttime blood pressure is just as critical, often even more so. More than half of adults over 65 are non-dippers, carrying 3 times the cardiovascular risk of those with identical daytime readings. 3 times the risk with the same numbers during the day. And this condition is almost never detected during routine office visits. It's a silent danger that most people live with unknowingly. There are everyday factors in your home that can make this worse. Licorice root hidden in evening tea. Alcohol consumed too close to bedtime. Grapefruit juice interacting with certain medications. 3 tests can reveal the complete picture. ABPM, urine microalbumin, and oxidized LDL. These tests are available, affordable, and rarely ordered unless you specifically request them. Bedtime dosing of blood pressure medication, supported by data from over 20,000 patients in the Hygia Trial, can reduce cardiovascular risk by nearly half in appropriate cases. And Hibiscus tea, 10 grams of properly prepared deep red infusion, taken about 1 hour before bed, has real clinical evidence as a supportive daily strategy. Now focus on 3 simple steps. First, check your tea cabinet tonight. Second, write down ABPM, microalbumin, oxidized LDL. Third, ask your doctor about evening medication timing. Has your doctor ever talked to you about nighttime blood pressure? Have you ever used a 24-hour monitor? Share your experience below. I read every comment, and your input can help others understand what questions they should be asking at their next appointment. If you found this valuable, share it with someone over 60 who matters to you, a parent, a partner, a close friend. This is the kind of information that often slips through the cracks between appointments. Your share could be the connection someone needs. Subscribe if you want to explore cardiovascular health after 60 in greater depth. There is much more to cover, and this is just the beginning. One final point, clearly and directly, everything discussed here is for educational purposes. It reflects current research and clinical experience in cardiac care, but it is general information, not personalized medical advice. Your health profile is unique. Your medications are tailored to you. Your biology is individual. Before making any changes, whether adjusting medication timing, adding supplements, or modifying your diet, speak with your doctor. That conversation is not optional. It is essential. It is the foundation of safe and effective care. Better information leads to better conversations. Better conversations lead to better outcomes. That is the chain that matters. Take care of your heart. It has been working for you every hour of every night without stopping, without rest, without complaint. For decades of your life, it has carried you forward quietly and faithfully. The least we can do is pay attention, ask the right questions, request the right tests, and have the right conversations with the right people. Now you know exactly what to ask, which tests to request, and how to approach that conversation. That knowledge has real measurable value. Walk into your next appointment prepared. Walk in with clarity, walk in with purpose. That changes everything. I'll see you in the next video. Until then, take exceptional care of yourself and the people you love. And if you have questions or want to share your experience, the comments are open.